The simple beauty of a single cell, a neuron, programmed to send and receive impulses throughout the mind and body. An infinite number of neurons interconnect and communicate as a complex exchange of information completes the central nervous system, unquestionably the most sophisticated circuitry known to man. But when things go wrong here, they can be the most difficult to correct, demanding a highly focused exchange of information among neuroscience experts, working together to channel innovation and insight into compassionate care that changes lives, that saves lives. This is the Wallace-Kettering Neuroscience Institute. The advancements brought to Dayton, Ohio by the Institute in its brief history span a wide spectrum of neurological disorders, from treatment of tumors, epilepsy, and stroke, to how we identify and care for diseases like Alzheimer's, Parkinson's, and schizophrenia. Here you'll find an unprecedented team effort with one central goal in mind: to make life better for patients. In fact, developments at the Neuroscience Institute impact the entire science of medicine. What we learn about the brain can be directly applied to disorders throughout the body, changing how we approach and treat diseases of all kinds. In 1995, a grant from the Wallace Foundation launched a community initiative to develop a landmark neuroscience center in Dayton. The Wallace-Kettering Neuroscience Institute was created and is now based at the Boonshoff Center for Neuroscience at Charles F. Kettering Memorial Hospital. Working together, Wallace-Kettering Neuroscience Institute scientists discovered a way to fuse MR and PET images to create amazing new maps of the brain. Images that allowed surgeons to pinpoint precise brain locations and brain function and navigate the central nervous system. Researchers also perfected computer-assisted surgical devices, advancements that are now being replicated at institutions across the country.
I've been in neuro for a number of years, and this has been the most exciting last 10 years in neuro that I can imagine, and what's going to happen for the future. I mean, what we could offer people in the past was so pitiful compared to what we can offer them today.
Our goal is to try to deliver this very effective, technologically advanced care in a compassionate environment, rechannel what we've learned for future generations of patient care, and also be cost-effective in this ever-growing, changing market of medicine.
And now, with a solid foundation in place, sights are clearly locked on the future. Today, physicians and scientists at the Neuroscience Institute have a remarkable assortment of weapons at their disposal. By combining resources like PET, MRI, ultrasound, and computer-assisted surgical technology, the healthcare team has a definitive edge: clearer vision.
The neurosurgeons are kind of like travelers in the brain, and they need a very detailed map of where to go and where not to go in order to treat tumors and other problems. The medical imager is the person who draws the map out for the neurosurgeon and allows the neurosurgeon to travel through the brain and treat the patient without fear of destroying an important structure or missing a part of the tumor.
The differences from 5 years ago is that the patients now are ready to be dismissed from the hospital much sooner. They're healthier. Now the surgeon can make smaller openings. They can do less damage going in. They can do less damage while actually removing tumors or any vital structures that need to be saved. Therefore, the patient wakes up, they're less sick. They have less complications, and in general, they do a lot better.
The Neuroscience Institute has, first of all, allowed us to keep all the technology here cutting edge. Whenever there's a new technology out in the market, we are the first to get it.
Like the next generation high-definition PET scanner, bringing with it dramatically clearer, higher resolution pictures of brain biochemistry. Images like these enable physicians to more precisely target actively growing tissue in the brain that could signal an abnormality.
What PET scanning tells us is what is this tumor doing? Once we determine what that tumor is doing, for example, if it is very active, then we can say, yes, it should be removed surgically, or if that's not possible, it should be treated with radiation or some other means of treatment.
PET scanning has given us a way of looking at brain function and brain metabolism, which has been very important in helping us localize where seizures are arising from. At the same time, it allows us to non-invasively identify certain areas of the brain that are important for speech and language, for motor activity, so that we can, without having to go inside the skull and stimulate the brain directly, we can make functional maps of the brain non-invasively without any risk to the patient.
Positron emission tomography also offers immediate feedback on the effectiveness of drugs used to treat epilepsy, depression, and mental illnesses like schizophrenia. For instance, by testing patients in areas such as attention, concentration, language, visual or spatial ability, and memory, physicians can now see the brain in action and more accurately diagnose and assess the impact of drug therapies. One of the most remarkable of recent advancements in magnetic resonance imaging is fMR, or functional magnetic resonance imaging, which grants a means of identifying functionally activated regions of the brain non-invasively. This technique relies on the local physiological changes that are associated with activation or stimulation of the visual, motor, or other brain systems.
Functional MR has very high temporal resolution, meaning you can do it in real time. And that's something that actually is state of the art.
If you have a tumor that's in an eloquent part of the brain, meaning that it's in a very sensitive area, either in the speech area or maybe in that area that controls the hand or the leg, the surgeon has difficulty in deciding how much of that tumor he can take out, if any. So with the tools that we're talking about, with a functional MR, we'll be actually able to pinpoint those areas of the brain that operate the face, the arm, the leg, so that the surgeon has a much more precise map.
Using a combination of imaging technologies, neuropsychologists also can help to establish a diagnosis of Alzheimer's disease.
When the patient is actually in the unit, what we'll do is show them pictures of line drawings and familiar objects like house or a flower or a toothbrush, having them try to name that object, and then seeing on the actual image what areas of the brain seem to be involved with that. Alzheimer's patients tend to have more difficulty with naming things, and so this would give us one way of seeing if that particular brain region is involved in that specific patient.
Microelectrode stimulation and recording done during a surgical procedure are being used in conjunction with deep brain stimulation to bring new hope and an entirely new level of control to what were once considered uncontrollable tremors, such as those associated with Parkinson's disease.
This technology lets you stimulate the area by using a little pacemaker through this electrode that's been placed down into the brain to tell the body to stop doing that, essentially.
By waving a magnet to activate an implanted device, tremors cease. The surgery is a lesson in teamwork. First, the surgical team attaches a stereotactic cage to the patient's skull to help align the surgeon's path. Next, a neurophysiologist creates a physiological map of the patient using intraoperative recordings. This helps the surgeon precisely control placement of electrodes in the brain using a robotic control device within a millimeter in either direction. The electrodes are connected to a small pacemaker on the chest wall that will control the unwanted movement. Next, a skilled neurologist programs the device to maximize its effectiveness and minimize side effects. This life-changing technique is giving patients a new sense of control and a dramatically improved quality of life. In a unique transfer of technology project, the Neurosciences Institute has teamed up corporate partners to test a paradigm-altering technology that will change how both pilots and surgeons perform their duties. Using alternative display and heads-up technology, information such as an airplane's vitals is projected before the pilot's field of vision while his eyes remain locked on the target. In the surgical arena, it works the same. The physician has an instant and direct view of multiple sources of information.
What we're going to be able to do with virtual retinal display is have him look at an image directly displayed on his retina and not have to look away from where his hands are working. And for a neurosurgeon, hand-eye coordination is obviously everything.
An unprecedented exchange of ideas, technology, and creativity that promises to dramatically impact the lives of surgeons, pilots, and most importantly, patients.
Anytime someone goes through a major diagnosis such as a brain tumor, their first question is, am I in the right place? And I can say to them that I think you are in the right place. And I don't say that because I work here, but I know that we have some of the most cutting-edge technology in the world. And so to have that all in one place in a community-based hospital, I think provides us with the confidence that we can portray to patients and that you are going to get the best care.
At the Neurosciences Institute, some of the most exciting medical advancements are being put to work changing the lives of those who suffer from epilepsy. New mapping and navigation techniques, such as PET activation studies, significantly improve a physician's ability to surgically resect a focus area.
In epilepsy patients, we use intraoperative monitoring to help localize where the epileptic focus is. But just as important, we help localize where important brain functions are in relationship to the epileptic focus, so that we can know that by removing the epileptic focus, we're not removing, for instance, a speech center or a motor center.
The advantage of some of the newer techniques that we're using has to do with precision. The greater the precision, the better that the patient does, the less time that the patient spends in the hospital.
In cases where a patient's seizures aren't adequately controlled by medication, when surgery isn't an option, or if surgical removal of the suspect brain tissue doesn't help, Neuroscience Institute physicians now offer a treatment that can significantly improve the quality of life for many patients with epilepsy. Patients like Jennifer McFarland.
I was having, I guess, at least one a day, if not several a day. I would fall, I had broken nose, dislocated rotator cuff, black eyes. I was tired of playing the drug game and feeling like a laboratory rat.
Jennifer's seizures began late in life, following a high fever that left scarring on her brain. After years of unsuccessfully seeking medical help, Jennifer finally turned to the Neuroscience Institute, where doctors suggested a new type of treatment, a vagal nerve stimulator. This device stimulates the vagus nerve, in effect telling the brain to shut off the abnormal electrical activity that signals a seizure.
The vagus nerve sits right next to the carotid artery, and we put a little silver electrode around the nerve. Then we put what looks like a cardiac pacemaker on the front of the chest, and that's what we use to program to give different stimulus parameters, so we can change the frequency and the strength of the stimulus. And the idea is that this thing periodically goes in and gives little stimuli which tell the brain to quiet down.
The patients have the ability to turn the stimulator on at any time, so that if they feel a seizure coming on, or if someone with them sees a seizure coming on, the stimulator can be triggered right at that point and can potentially abort the seizure or shorten the seizure, which has been very important for our patients.
Jennifer now has a mild seizure once every week or two.
Before I had it, I thought I was just digging myself deeper and deeper and deeper into a cave and was never going to get out. And now there's light at the end of that tunnel. And I see myself maybe even going back to work one day and maybe driving one day again and living like I used to, like a normal person. They've made me a human being again.
Add to the neuroscience arsenal another very impressive weapon, the Gamma knife, a major step in the advancement of minimally invasive surgical techniques.
It's actually developed through a helmet that's placed on the patient's head, and 201 sources of energy are focused at a pinpoint spot in the brain, essentially destroying that portion of the brain, but preserving the other normal areas of the brain. Also, it doesn't involve any incisions in the scalp. We just simply place a frame on the scalp, do our treatment planning, and treat the patient. And often they're surprised at the end of the day that it was as simple as it was.
It truly is surgery without a scalpel. Though not every patient is a candidate for Gamma knife, for those who are, the treatment is non-invasive and relatively painless when compared to the alternative.
Typically, craniotomies have involved several days stay in the hospital at least, and there's always the risk of surgery itself. Whereas with Gamma knife, the risks are quite low, and the patients usually leave the same day. Patients like that very much, their families like it, and the insurance companies like it.
The Gamma knife is being used to treat tumors in the brain, particularly those that are deep and surrounded by normal tissue. It's considered one of the best choices for many patients with blood vessel malformations. The Gamma knife also shows great promise in helping people with Parkinson's disease, epilepsy, obsessive-compulsive disorders, and some types of headaches. Gamma knife is also a very attractive technique for those suffering from uncontrollable facial pain caused by trigeminal neuralgia or facial tics. For most patients who suffer from this condition, drugs offer little relief from the constant pain. Because Gamma knife can be targeted to such a small and precise area, it's being used to destroy the base of the nerve inside the brain where the pain and abnormal movement originate.
You know, 20, 25 years ago, the goal and the care of a stroke patient was to bring them into the hospital. We would watch them complete their stroke and just provide supportive, palliative type of care and perhaps give them some rehab. Things have certainly changed considerably in what we can do for the stroke patient.
Today, using a combination of imaging technologies, physicians at the Wallace-Kettering Neuroscience Institute are diagnosing and treating stroke victims with some very exciting results.
We can use these imaging systems, these new imaging systems that we have, to rapidly diagnose not only if the patient's having a stroke, where the stroke is in the brain, how big it is there brain tissue that's at risk of stroking but not yet experiencing a stroke.
The advent of drugs, such as TPA, has had an enormous impact on stroke treatment. Yet, while TPA can be a lifesaver, it has some serious limitations.
The patient, that means, has to identify the stroke, get to the emergency room, get a CAT scan to make sure there's no hemorrhage, and have the drug in their vein by 3 hours.
At the Neuroscience Institute, neurologists are investigating new MR perfusion diffusion imaging technology to help stretch the 3-hour window. These images can show if brain tissue around a stroke area is still salvageable, regardless of the time since the stroke's onset. The hope is that someday doctors will be able to administer clot busters based on the patient's actual condition, even if the time since the stroke is unknown. Fortunately for 46-year-old Sam Snyder, doctors knew exactly when his stroke began. While visiting the Dayton area on a business trip from his home in New Jersey, Sam began to feel something wasn't quite right during a morning meeting. He was rushed to Kettering Medical Center.
The doctors were right on the ball. They got the drug to me in plenty of time. The whole idea of the TPA, I'd never heard of it for a stroke. And I was willing to try anything because I didn't want to be crippled. And I wanted to walk. I wanted to be a whole man for my wife, who I just married.
Sam had suffered a brainstem stroke, but within about a half hour after receiving TPA, his functions began to return to normal. he was up and walking the next day.
On the 5th day after my stroke, I flew home. I walked through the airport, I got in someone's van and went home. I spent the next 3 days in my house walking, getting my balance back. Within a week I was driving. Within 3 weeks I was back to work. I'm one lucky person.
Some people would rather die than have to live with a stroke. But there are many things that we can do now with a stroke to change those kinds of outcomes and make it much more positive.
Using minimally invasive surgical techniques, high-risk and inaccessible aneurysms can be safely and efficiently treated. For these procedures, the physician approaches the aneurysm by working through the vascular system. Coils can be precisely placed to strengthen vessel walls and cut off bleeding in the area. Stents can also be placed to block the opening where an aneurysm is formed. What if, in the near future, we could arm the body itself to fight tumors for us? Wallace-Kettering Neuroscience Institute researchers are now participating in a Phase 1 clinical trial for gene-modified immune therapy, a technique that attempts to marshal the body's own immune system to kill tumors in the brain. Neuroscience Institute physicians and scientists are a part of the team testing this new frontier in medicine, working with new techniques and innovations that may revolutionize how cancers of all kinds are treated in the future. Putting new technologies to work, changing lives, wouldn't happen without the commitment to teamwork that's been a hallmark of the Wallace-Kettering Neuroscience Institute vision since day one. It's a team that includes physicians, staff, and generous donors.
One of the really positive things about the Neuroscience Institute is the possibility of collaborating with professionals from a number of different disciplines. And that's not something which is either actively encouraged at other places or is even possible at other places.
And I find that combination of research, technology, and cutting-edge neurology in a community-based hospital unique and very exciting.
Well, the Kettering Medical Center owes a lot of its existence to the Kettering family, and I think many people who work there have studied Charles Kettering, read his books, and I think very highly of someone who has spent his life dealing with innovation, trying to create solutions, practical solutions to problems. That's exactly what they're doing at the Neuroscience Institute, being encouraged by a set of physicians who are not shy about using new technology, about applying techniques to patient care so that they can improve what they're doing, and support people in both technical, administrative, and scientific areas that are excited about working on a project that can improve patients' lives.
And right now we're looking at embarking on areas of surgery that are very sophisticated. And also we have just a team of people that is continually growing. They're enthusiastic, innovative, and bright, and dedicated not only to effective, innovative patient care and high technology, but also compassionate treatment of the patient.
Oh, I think it's marvelous to be able to offer the people in this area anything that's available to anyone in the world. And there aren't very many places that can say that.
Check back in 5 years and see where we are. This will be the very interesting, no one really is sure what's going to happen to us, but we're all very excited about the possibilities.
Creativity, insight, innovation, changing lives, saving lives. This is the Wallace-Kettering Neuroscience Institute, defining a new vision of neuroscience for the future.